Hi, everyone. Welcome to Foresight's Biotech and Health Extension Group, sponsored by 100 Plus Capital. It's really, really wonderful to see you here. Today will be a pretty interactive brainstorm more. And before we get to that, I just want to make you aware of two things which we're about to launch. Number one is, and I'll quickly share my screen for that. So this is our annual Biotech and Health Extension competition. And I'm really excited about the fact that we're getting in person again, and this time for real, in the sense that this group was launched as an in-person meeting for individual investors to get together and look at really great new projects in the space. And we sprung out of our technical competitions. And this is where we're getting back to this year after an unfortunate COVID break. So very, very excited to go back to in person. I'll be sharing more info on this just after the call, but this is just to announce it officially to our group. This will be happening on May 21st, 22nd at IndieBio in San Francisco. And the goal is really to develop a few undervalued opportunities in the biotech and longevity space and curate like a really like well-curated set of challenges that other people could take on. We have a few wonderful set of confirmed invitees already. This would be very much like a brainstorm workshop. And we have a few really good sessions already, but this is to say that the applications are open. So somehow people already were able to find this, and we already have a bunch of applications without really ever having it publicly announced. So that's great. But if you're now hearing this, applications are open and you're welcome to apply. I'll also be sending an email list, at least to our group. But for those of you who are listening to this on YouTube, which are many, then there's an open application form as well. I also want to say that we're now in the last few days of our Gitcoin bounties. And so Gitcoin bounties function by the number of people donating, not by the amount donated. And so if you're interested in supporting us, we would love your guys' support. That's in crypto for our tech tree bounties and for our fellowships. And so this is just to, soon closing opportunities. And we really hope you join us there. That's it for me for now. I'll be more in the chat. For today will be a little bit of a different session in the sense that today we'll be brainstorming with Dylan Livingston on what it is that A4LI can be achieving this year. And we really want to pick your guys' brains. But before we can do that, first we want to introduce Dylan. And so Dylan, perhaps I know that, for those folks that have watched last year's videos or are even on the call from last year, they still have a little bit of an understanding of what it is that you guys were up to and how it is that you guys started. And I think, especially those people that have listened in on your policy sessions in our group and your last two, they have a bit of a better coding, but some of them may be new to A4LI. And so maybe let's bring them up to speed before we pick your guys' brains on what it is that you guys are doing, what your mission is, and what perhaps a few upcoming projects are. So how did you start A4LI? What's up for you next? Give us a little bit of a coating.
Sure. Yeah. Thanks, Allison. Before I just get started on that, I just want to profusely thank you for giving me an A4LI platform. It's been helpful to build out the organization. We appreciate and look forward to, future collaborations with Foresight. A4LI really started when I got in touch with you, Allison, if we're being honest. So the organization kind of came around in the early part of 2021. I had this idea after working for the Biden campaign in 2020. I'd gotten really invested in longevity space during COVID, and that kind of lined up with my political career. So I decided to get involved in that space. I'm sure a lot of the people in the audience kind of know what A4LI is up to, but just so if you don't, I'll just give like a 1-minute brief. We're the first and only 501c4 nonprofit organization for the longevity biotech community. The 501c4 designation makes us unique in that we can interact with politicians in ways that organizations like Foresight cannot. That is helpful because there's kind of a void in the space there. There's no other organizations doing it, and the U.S. government sets the regulations for a large majority of the longevity biotech companies in existence today. So we want to be in communication with them and on a constant basis. So A4LI is looking to kind of open a line of communication between the government and the longevity industry. And our first big initiative there is creating a longevity caucus in Congress, a bipartisan group of Congress people, and we're going to focus mainly on the House of Representatives first. And we're going to pick from the districts where longevity is prominent. There's where the companies are, where the research universities are, things like that. And yeah, so that's kind of a big step in that caucus will exist permanently. It will be able to be used by other members of the longevity industry, not just A4LI. And so we're looking to kind of open this line of communication that was not there before. So I'll stop there for now. But I'll just give a little background on what we've been up to since I last came on in February. So that was only a month ago, and we've done a lot. We officially moved down to DC. We moved the organization down to DC. We're right off of K Street, 910 17th Street Northwest, DC 314. So if you want to send any mail or anything, send it there. And so I've been down there the last few weeks setting up the office with our new director of communications, and we're off and running on that. And the second big thing is that we have more or less confirmed the first congressperson to be on the longevity caucus. So I don't want to give away too much. I don't want to spoil too much or jinx anything. But he'll be representing the Democratic side, and he potentially could be a co-chair type of person, which is very exciting because getting those first few figures involved is always the hardest. But once we have them, we can kind of it gets a little easier. And then that's on the Democratic side, and on the Republican side, we have an idea of who we're going to target as a co-chair also. And so I think it's reasonable to say that we'll have the public faces of the longevity caucus sometime in summer, fall. So it's coming up soon, and that's also a bit conservative. We'll see, but I don't want to overpromise. But it's very exciting. So yeah, the last two policy sessions we had, I brought on a special guest representing both sides of the aisle. Our first guest was Adam Bramwell, A4LI's lobbyist, and he was the former chief of staff to Chris Coons, the Democratic senator from Delaware. And then last month we had Joe DeSantis on, who was Newt Gingrich, who is Newt Gingrich's chief strategy officer and one of A4LI's board members. So as you can see, we're trying to make this a bipartisan effort, 50-50 split down the line. Longevity becoming a partisan issue would be a really terrible thing. So we're trying to avoid that at all costs. This session, though, is going to be a little different since we wanted to try something new and different. We want to use this time to brainstorm ideas for A4LI's futures. And, since this Foresight group is kind of the base of A4LI's support, and ultimately we're advocating and representing you guys, we want to hear directly from you, to make sure that we're in line with what the community wants. So I think Allison is going to ask some questions to the group. And please feel free to chime in. My hope is I spend a lot of time listening and taking notes and less time talking, because I want to hear what you guys have to say. So, Allison, do you want to take it away, I guess?
I'll take it away. So just to reiterate Dylan's point, this is a little bit of a different session in which, we really want to make sure that, the longevity industry and the longevity researchers are really represented well. And so it will be like a reverse interview where we are interviewing you. And so please take this as a super free brainstorm. We can always redact things from the recording. So if afterwards you're like, hey, this should not be public, just reach out to me and we'll happily remove it. Okay. So feel free to actually really brainstorm here. And so maybe, maybe we can start a little bit with just creating the group. What do you think are perhaps the number one areas that you think are really underrepresented right now in politics in the longevity space? Like if, for example, this is like a customer interview, then what do you think are like a few of the areas where you're just like, this is really a blind spot right now in politics. I really wish this was more of a discussion topic. And I don't understand why this is not being elevated more. Anyone here on this call, please take it away. This is, I think a safe way to brainstorm that of topics that could make it actually into into some of the more Washington, D.C. Okay, we have Adrian here. Go for it.
Uh, so I don't know if people are familiar with the All of Us program, which is collecting health records by the government for 1 million people. And part of the founding of the program was that individuals would have access to their own health records, as well as researchers. That part was not implemented yet. And the ability to have access to large numbers of health records, both by industry and, educational institutions and individuals, would, without red tape and without various restrictions, would significantly improve the ability to have innovative research projects in this space and reduce their costs, since the government is collecting all of this data, hopefully clean, and there's genomic data in there and stuff like that. So from my perspective, I've tried to get them to implement this access policy, which is, again, was part of how they sold it originally. And that funding needs to be provided if they need it or whatever, but they have to follow through with this. Thank you.
Thanks. Great. Dylan, any immediate reactions?
No, I don't have any immediate reactions, but we can definitely discuss that off the record, once I get my thoughts around it a little more. For sure.
Wonderful. Anyone else? This is your time to really get your ideas out. Okay, I think Christine had a point.
Yeah, I haven't seen. I think one way to come at this, and we've talked about this, but I still haven't. I don't think I've seen any numbers on it. Which is, it seems like we don't see enough emphasis on how much money the government could save by improving health span, right? So, and I think those numbers would be really large. And yes, I know Social Security, there's that issue, right? So that's the third rail in politics. We all know that. But we could focus on the savings to Medicare. And I think, and then we could think about, well, who are the constituencies for that point, right? Because I really think those dollar figures are huge, and there ought to be constituencies who would care about that.
For sure. And one of the things we're pushing, Christine, I'm sure is getting the Congressional Budget Office to actually run their own numbers on the longevity dividend argument and all that kind of stuff. So, we're definitely working on that. And I think getting the government to actually run their own study will open their eyes in a way that, the Andrew Scott longevity dividend argument might not. So that's something we're definitely pushing for.
Wonderful. So you're already listening in that regard. Next one up, we have Abdul Kader. I'm sorry. I hope I'm not butchering your name.
Yes, hi. No, that's fine. I mean, you can call me also AB. Very simple for it. Yeah. My question is the following. If we improve on the health of the individuals, would actually the consensus of these individuals be accepting the fact that retirement will be postponed? And also the benefits of retirements will be postponed because naturally the actual biologic age will be more important in that case rather than the chronological age. So is that something that individuals are ready to accept? That's my question.
I'm ready to accept it as an individual. And I would also like to say that isn't that bordering on one of the major longevity economic arguments like Aubrey de Grey and people like that state, which is, if our retirement age is set from the world of a generation ago, then it's kind of silly because people, if they're fit and sharp and in their 70s and 80s, and I know a lot of such people, they actually have accumulated knowledge and experience that makes them extremely valuable, so that we don't keep making the same mistakes and to, solve problems that are hard. And that's a huge boon to the economy. It's not just saving money, it's going to boost it.
So in that case, what you're saying is we will impose on those individuals a different retirement age officially. Is that what you say?
No, I think what we should do is it should be like welfare, and I don't mean to monopolize. I'll land the plane in a sec. I think it should be like like welfare versus work. Like what it is, sure, I could retire on my little government pension, or I can stay fit and sharp and and make a lot more money in the workforce. And, then presumably my pension would be deferred, and it wouldn't be such a hardship for me because I'm doing better by staying in the workforce. So I don't think it has to be like, you don't impose. Yeah, we could maybe do it without harming anybody.
Yeah, because, we have to understand that out of the aging advancement, there will be some laws coming out. Some of those may not be agreeable to everybody, and some of them will impose on us certain restrictions or certain disadvantages as perceived by the individual. It's not all across the board something advantageous or let's say agreeable to everybody. So there is also some kind of intrusion on the individual where you have to determine by examining health and certain parameters how old that individual is and whether he actually fits the retirements or not. So there is some kind of intrusion on privacy, of that individual. So we have to be able to handle these type of questions. That's my point.
Wonderful. Dylan, any immediate comments to this? Feel free to just listen in. But I just want to give you a space to react.
My only immediate comment is just in terms of what A4LI is doing. Our first step is increasing the amount of funding for research to actually find the cure for aging. The second step is convincing people to take the drug so we can actually achieve the longevity dividend. And the third step is reforming our institutions around the fact that people are going to live a lot longer than they once thought they were. So, down the line, this is the whole retirement age, Social Security, what was everything that was just said is something that is kind of like a step 3 kind of endeavor there. But, it's definitely something in the pipeline for us. But it's our immediate effort is getting funding and the government, more involved in making the environment favorable for the longevity biotech industry.
Wonderful. Okay. I like the different tiering and stages that you have. Next one we have Anar. Anar, can you unmute?
Hi, sorry. Yeah. Took me a while to unmute. Hi there, Allison. Hi, Dylan. Nice to talk to you again. Can you just help me understand this better from like a politics 101 perspective? What's the best way to get politicians aboard, right? Is it lobbying directly to politicians, or is it indirect where first you have to get public interested and then politicians will get interested because they cater to the public?
Well, I think it's kind of like it's a self-feeding loop a little bit. Getting politicians talking about the issue makes their constituents more aware, which makes the constituents talk about it more, which gets the politicians more interested. And it's kind of a self-serving loop, and it has to start somewhere. So we're going to start it by getting politicians to talk about it by doing this caucus and getting people to announce that they support what we're doing and things like that. Hopefully that will perk up some ears in their congressional district. And, we're not expecting longevity to be like a cornerstone issue for any, politician. Right. But, we just want to get the level of, support in congressional districts high enough so that when we have more concrete initiatives, when we ask, the Longevity Caucus to increase appropriations to the NIA Division of Aging Biology, there's some public support behind it. So, it's not like longevity's, I mean, I don't think longevity is ever going to be kind of like a cornerstone thing for any one politician, but we need to, kind of make, just make conversation happen. And we're starting that, on the politician side. But are you talking about like a specific initiative that you're pushing, or what are you referring to?
I was trying to kind of set the high level understanding of like, what's the best bang for your buck, right? Is it about changing people's mindset, and then
Sure.
as part of that, politicians will get interested, or is it lobbying to politicians? And then, but sounds like
Well,
it's kind of,
there are a lot of organizations in the longevity space who are already kind of doing public advertising to the general, community. I mean, general public, right? They're organizations like Foresight, right, are already actively, bringing more people into the fold. So, A4LI kind of has a different mission in that sense. We're doing something that Foresight, can't do, and other 501c3s can't do. So, right now we're focused on that and less on the public persuasion campaign aspect of it.
got it. But you still need to persuade politicians.
Right.
So
We're doing
pretty
that on
much-
more of like a shotgun shot kind of straight,
Yeah.
Straight barrel shot, instead of kind of, because the fact of the matter is also, we would love to be able to go on an effective public persuasion campaign, but that costs a lot of money. And if you look at, other 501c4s that we're kind of competing with, the NRA, the Sierra Club, those kind of organizations, they fundraise hundreds and hundreds of millions of dollars a year. And that's why they're able to effectively go on these public persuasion campaigns. You can't do it with a few $1,000s, right? So, so that's why we're focusing on this lobbying, this politician path, to start at least. Hopefully one day, knock on wood, we get to that level where we can do both. But right now, that's the path.
Yeah, it makes sense. It'll be interesting to see how do you decide what is the best pitch, so to say, that's most likely to get a politician on board. And of course, it's not like the same pitch to every politician. They're probably all customized and different, but there's some, commonalities amongst them, right?
Right.
So it'll be interesting to see where you decide is like the most optimal one that's most likely to result in a yay and not an nay.
Right. They're every politician is already on their own. They have a list of the committees that they're on. They have a list of the things that they care about, right? So you have to kind of relate it to what they already care about. So the politician that I've already spoken to he's very interested in space, and so I kind of tied it into the general futurist community and say, this is, if you're interested in space, and he's also very interested in the environment. I kind of tied it into the future of humanity, and this is also another kind of step, right, for humanity to evolve into something more than we are today. And I kind of tied it into something, made it like that. But if you talk to someone like Anna Eshoo from California, I know she's on, I forget which committee she's exactly on, but she has her focus is ARPA-H, right? That's her stated focus for the year. So, tying it into what she's focused on, well, that's an easy one right there. But, we're going to be trying to tie in what we're doing with what they're already doing. That's kind of the formula, but you just have to pick and, you have to customize it, like you said, for each one, for sure.
Cool.
Wonderful.
Yeah.
Thank you, Anna. Next one up, let's see if Micah can speak. Micah.
I can speak just a little quietly. I have a couple questions. I'll start with the first one. What is a order of magnitude of the amount of money it costs to do this sort of lobbying with politicians? Like, I have no idea. Does it cost $1,000, to functionally and effectively lobby with politicians, or is this like a $1 billion thing?
Well, there are different levels to it, right? And it's also about how we'll allocate the money that we get. If we could be effective at where we are now, right? We could be effective, at $10 million. We could be effective at $100 million, but it's just, where we're going to put that money. The most, the most successful lobbying 501c4 organizations are the NRA, right, or the Sierra Club, like I just mentioned. But there are others like the American Cancer Society Cancer Action Network. The American Cancer Society has their own 501c4, and they operate on the magnitude of like 40-50 million dollars a year. The Alzheimer's Association one, I think, operates at around like 10 or something like that. So, you know, those are the numbers we're competing with, right? And you know, I didn't even really mention the fact that we're also going to be creating a PAC in the next few weeks, and you know that will. You know, I hope everybody here can donate to that PAC, and you know we can try to raise some money, because that's how we're actually going to be able to contribute to these politicians. So, and in terms of what will make a politician notice, you know, I mean, $1,000 will do it if you want a politician to just kind of take notice of who you are at like a fundraiser or something like that. You know, from my experience, my limited experience so far. But you know, if you look at opensecrets.org or .com, whatever it is, you'll see the top spenders by election, right? I think, you know, our goal should be, A4LI's goal should be to get on that Open Secrets page and be one of the big spenders of the, you know, of the next election, or, you know, 2 elections from now, because you know, that's really how people kind of take notice, right? You know, that's how politicians take notice. That's how the world works, right? So, you know, but we can be effective at any kind of level, I think.
What's the range of numbers on the Open Secrets list? Like, what does it take to get on that list?
I don't remember exactly, but it's something along the line of maybe 100,000 or something like that. I forget. I forget exactly what it is. I'll have to look that up.
Okay, wonderful. Well, we can do some background checking. And please, you know, once you start raising for this, then let us know and we'll share it with the group. I have a question that is quite relevant to what we just discussed that was sent to me writtenly, which is I'm curious what the norm is for people from DC attending scientific conferences in areas in which the government explicitly takes actions, i.e., at various times, there have been explicit governmental action on cancer, war on cancer, cancer moonshots. Do lobbyists or staffers or various elected officials interface with the relevant scientific community directly through side meetings, or do they attend relevant open meetings in the specialized areas of legislative or executive actions? I asked to understand whether it's time to start inviting targeted staffers to scientific meetings in this area.
I'll have to get back to you on the first part of that question, but the second part, absolutely, it's time to start inviting staffers. Not only because, mainly because every staffer that I've talked to about this is interested in the space, right? And, you know, just kind of growing the community is important, whether it be the general public or political staffers. You know, we're all just people at the end of the day. So, you know, I think, and that's, you know, part of the reason we moved down to DC is so we can figure out exactly, you know, like you said, like, you know, do staffers go to these congressional scientific hearings? Do they go to other events in the area? Like, you know, that's why we're moving down to DC, to kind of get a lay of the land and figure out, you know, everything, because, you know, A4LI is a young organization, and lobbying in general for the longevity community is young. You know, I don't think anybody in the community truly knows. So, you know, we're trying to take that first crack at it and figure it out, right? So that's why, you know, that's why it's important to physically be in DC, and that's why we've, you know, made that kind of investment to move down there. But I'll have to get back to you more specifically on that one, and I'll let you know over time. But, you know, we'll be inviting people to specific events that we do moving forward, different, you know, staffers that we've been in touch with.
Okay, wonderful. Well, I do think that, you know, part of the value is like kind of like education via osmosis, you know, by having different folks sit in on these meetings. You know, we often have like FDA attendance in here, and I think that's usually like makes for a really good back and forth. And I think that's like, it's a value, like very low hanging fruit exchange of information. Okay, wonderful. That actually brings me to a question. And maybe I'll ask you that, but anyone else here also is welcome to jump in. It would be, you know, if there is any collaboration also across different efforts with other nation states. So let's just, for example, say, like, you know, for example, there's the the all-party parliamentary committee, right, for longevity in the UK that I think Tina Woods is leading and so forth. So I wonder if there's even any any transferable knowledge across what worked in other countries, or how they're handling it. I'm sure, like Andrew Scott, for example, he's based in the UK, and so for what it's worth, the longevity dividend arguments should also still be somewhat applicable here. So I wonder if there's if there has been much efforts and coordinating efforts, and if not, what could be done more.
So last month, A4LI, we ran our policy discussion. We had Andrew Steele from the UK and Damien Green, who heads up the APPG for longevity. So we kind of did that in the context of we wanted to talk with them and give American politicians an example of what's already been done, and why we're kind of behind the 8 ball already, right? Like we're there's already countries doing this, and we should be one of them. In terms of I have been trying to be extremely careful as a 501c4 organization to not accept or really work too closely with other countries, right? Because the IRS rules are so that they're strict, and as a new organization, now the worst thing that could happen is we get shut down in our like first year, right? So I've been very focused on trying to build capacity in the US. Reach out to mainly US based people. That's kind of the scope of the C4. However, there are other efforts, right, across the world that we can use as examples for why the US government should be, focused more on this. And it's worth noting that the US is where 80% of these longevity biotechs are anyways. So the importance of it's good that other countries are doing this, because it kind of gives us an easy way to get the government on board. That's all I'll say there. But yeah, I'll stop there.
Wonderful. Okay. Thanks, Dylan. So perhaps, okay, that's admitting a few more folks. So maybe one thing that I would also love to maybe throw back to the group. We've talked a little bit about specific topics that you think are somewhat undervalued. But if there's more, then it would be really wonderful for them to just send us your lists, basically, and that can happen offline. But I wonder if there's any. Oh, Micah has another question. You go, Micah.
This leads into my question nicely, so I figure it's a good transition. My question is, so it sounds like you guys are focused at the moment on figuring out how to get more funding for longevity research from the government. Is there any work that can be reasonably done to just get the government to get out of the way and let us, do things that we're not allowed to do, like treat aging as a disease? Like, is there some path we can take? I'm guessing that getting money from the government is actually easier than getting them to change regulations. But is there something we can do on that front just to make it so they're just not in our way, even if they're not helping?
So A4LI's stance on this is that we are going to be a little cautious with the FDA at first. And what we're thinking about pushing actually is something along the lines of the something similar to the regenerative medicine advanced therapies pathway. It's not necessarily, like you said, tearing down regulations that kind of stand in the way, but what it will do is give those longevity biotechs, with drugs in the pipeline, a way to kind of get ahead. So we're still working out the details there. But getting the FDA to redefine the word aging is quite a task, and especially with no longevity caucus. Like, once we get this caucus together, our ability to be effective in government will skyrocket, right? We'll have a group of 40 Congress people having our back at all times. So we're not really going to push anything too hard with the FDA until we have the caucus together. Really, everything kind of hinges on getting this caucus together, because it gives us the backbone and the support to make claims like that and push for things like that. So yeah, that's what I'll say there.
Okay, wonderful. I want to see, Larry, do you have any immediate things you'd like to chime in on here? It would be wonderful to have your perspective, but totally understood if you can't.
Well, yeah. As far as the update, I mean, I'm not in the policy realm. some of the problems have been, how do you measure aging besides time? A lot of, I know, there's these clocks out there, the Horvat clocks and things like that, but how do you really those things as real biomarkers? We had Chris Leptak talk and things like that. He's left the FDA now, but so you might want to get him back on again or something. Maybe he'd be more frank. But again, I mean, it's there's a lot of things that happen as you age, and there's a lot of the approach you took in the TAME where you have these various things to show that there's really health span improvement. I think is way to go. But aging is it's and then there's been so much chicanery that has happened in aging, I'm not going to mention names, but I mean, there's a lot of reproducibility problems and a lot of the research and things like that. And people have, overhyped it so much. I mean, and that's and so how to get realistic and show, that there's real, clinical studies or clinical evidence that, that leads to something. And, I mean, there's a lot of things that come in. I mean, diet, dietary supplements, things like that. And, does it have to be medications always and stuff like that? This idea that there's going to be a miracle drug or there's a single target, I think is a little naive, and that, organs, are, I think, there's been I mean, these are just my perspectives, but, I think, I'd love to see, health span be improved and longevity be improved. I mean, most of us, don't want to die or, but again, it's how to really, I think you have to, a lot of times we approve stuff too fast. We don't pull it off the market fast. I mean, Europe reevaluates every drug every 5 years, and drugs that don't work get off the market, but there's, but FDA, a lot of times we approve something and then it takes a long time for us to pull it and things like that. But it's getting, solid clinical data and then safety too. I mean, safety is a big thing. I mean, and that's, but yeah, how to, how to get real clinical trials that show real benefit is what, and maybe TAME will do that. I don't know. I mean,
I just on the biomarker issue, that is something that obviously we're aware of. I would personally like to think of it as a political will issue. And I mean, I'm just going to keep reverting back to this longevity caucus, but, getting a group of 40 passionate Congress people to, demand that, there's some sort of public-private effort to establish a reliable biomarker would be really powerful. So, I mean,
yeah, because I mean, it's a safety issue too. If we find drugs that, if there really is an aging biomarker and there's a drug that, really increases aging, that's a real safety issue, so, but that, can we really rely on that? But I mean, yeah, there's a lot of drugs that look really promising. I mean, the insulin role and, I mean, anything that, gets glucose out of the bloodstream without raising insulin is probably good, and, and that may, help health span and things like that. But whether diet, can do the same thing and things like that, it's, those are kind of the questions sometimes.
right.
Is there anything like apart from biomarkers that you think the, aging, let's say, neuroscience or longevity community isn't really doing enough that would just make it a bit more, like, let's say, appealing from an FDA or like, otherwise governmental perspective to,
Well, I mean,
just be able to see the value?
there's a lot of diseases of aging, and I mean, Alzheimer's the classic example, and we approved a drug, and there's a lot of controversy about that, and legitimate controversy, and I mean, are any of the is our concept of disease in that state, is it right? I mean, there's 4 or 5 different ways people think Alzheimer's happens, and I don't know if anybody knows. I mean, everybody had a lot of faith in the BACE inhibitors, but they seem to work the other way and stuff like that. So, I mean, I think focusing on a disease, happens in aging or, or things like that, I think, I don't think that's a bad way to go. And, cause until you get, a real well-defined biological clock or something, and, maybe people believe the Horvath ones are, but, how do you really prove that? if you look at 100-year-old people, are they, I mean, that's what I don't know. If the studies have been done to really validate these biological clocks and things like that. I mean, I'm not an expert in the area, but if you look at, people in Okinawa, in the blue zones, are there, they may have done a lot of that, but are there drugs that can really show an impact on that? I don't know. I mean, or do they show it, not just in blood cells, but in other organs? And how do you do that? Yeah. Yeah. And this is my perspectives, but
Of course, but it's super valuable. I think, like that back and forth is, I think, exactly what keeps the ball rolling on both ends. So thanks for sharing. I think Anna had an immediate comment.
Yeah, just curious to hear what folks think, like how important is it to have the biomarkers and things like that? Because like if I look, there is a climate solutions caucus, right? Like there's politicians against global warming or whatever the right term for that is, right? So if there was no biomarker for global warming, if we thought it's a bad thing, but we didn't know whether we could change it or what the right biomarker is, would that then mean that politicians would not be interested in it? Or would they still be interested in it because it's a bad thing and they would want to allocate resources to solve it regardless of tangible biomarker?
Well, I mean, the biomarkers are important for the FDA to also be able to approve.
Yes, absolutely. But I'm talking about in terms of getting politicians interested, in terms of establishing a caucus. Do we need the biomarker, right? Like,
well, for life extension studies, they would take so long that to do, and then when does the intervention happen and things like that. So I think they would help. But yeah, I mean, if you do a long-term study of a drug, for 30 years and show that there's that the people who are on the drug versus a control group had much longer lives, that would that would be that would, you wouldn't need a biomarker for that. Yeah, I mean,
100%. I hear you.
Study, but then you'd have to wait 30 years to get your drug approved. Then
where is the chicken or an egg, right? Is it, do you need a biomarker to get politicians interested, or do you get politicians interested and that results in more resources that would then result in production of the biomarker?
Can someone explain to me, can someone briefly explain to me, I know we've talked about it in this group, but I still don't get it. If you have a biomarker that you can determine is correlated with lifespan, how do you then show that an intervention which backs up that biomarker to an earlier quote unquote age actually increases lifespan and that there's causation there?
Yeah, that's the problem, Krian. Exactly the problem. Yeah,
I don't know. I'm just calling here out of the blue, but Greg, I see you on the call, and totally fine if you're just lurking. But in case you have any input to share from Jim Max, that would be valuable. I don't know if you have any immediate input. And five note.
Excuse me. I guess I can say just a few things. One, in terms of biomarker validation, there's been a great deal of biomarker validation, especially with respect to Grim age. I would refer you to the Clock Foundation for a lot more information about that. In terms of the last point that was raised about what is the biological meaning of reversing biological aging clocks or Horvath clocks, I think that the query is correct. We cannot, we can reverse these clocks, but there's no way to prove that it's actually extending lifespan yet. That's going to take more time. But what we can do is make supporting measurements that indicate that other physiological parameters, which we know are important, are actually going in the right direction. So one of the things we're looking at is the plasma pheno age, which in my opinion is more volatile than the other clocks, but it's based on measurements that are known to be important for longevity and health. And so if you see those things moving in the right direction, that's a good sign. At least it's supportive evidence. We measure improvements in kidney function. We all know that we need to have kidney function. So if that improves, that's a good sign. And there's a variety of other things like that. One of the things we like to measure is immunological performance. And if that's moving in the right direction, we know that's very important for longevity. There have already been correlations independently of the aging clocks, showing that all-cause mortality is dependent upon the integrity of the immune system as we get older. So if we see that moving in the right direction, all of those sort of things, when you consider them in the light of what's happening with a clock, indirectly tends to point to a possible benefit that's associated with the clock. So we're doing things like measuring exercise capacity, which is also very powerfully related to the risk of age-related morbidity and mortality going forward. Some of the people that we've been treating have had phenomenal improvements in their exercise capacity. And that's been happening mostly without any increase in exercise per se. So their overall ability to move weights around it, but also their endurance has improved without any training. So that's suggestive also that maybe the clocks are measuring something real. There's much more to be done. We're actually working on an amazing diagnostic that, if it works out, may help to address that question as well. But it's still early days, so this is all very experimental and exploratory. But the fact that such things do exist is encouraging. And I think, one of the issues for what Dylan is proposing has to do with credibility of the goal. So this is not the first attempt by any stretch of the imagination to lobby politicians to raise money for aging research. The American Aging Association was devoted to that for decades, never got anywhere. The Alliance for Aging Research was devoted to that for decades. They may have had some successes, but if so, they're kind of obscure. There have been other efforts as well. There may still be a group on Capitol Hill that's interested in lobbying for health extension in general. I haven't been in touch with them lately. But all of these groups have not been very effective. And I think what may change this now, I think what may make Dylan more successful, the kind of efforts he wants to do, is that now suddenly we have a raft of very believable aging interventions. And from what I can see, there's nothing that would prevent you from combining most of these aging interventions to have an even more powerful effect. So I think we can now point to real evidence and make people more accepting of the possibility that all of this lobbying effort could actually have some benefit at the end of the day, and not just in some distant future, but sometime in the next few years, so that it's actually relevant to the voters that the politicians are attempting to be on the good side of.
Wonderful. Super valuable. Dylan, do you want to react immediately or?
I guess the one thing I'll say that I say a lot is the timing. I mean, this is not what my original quote, but this is Ray Kurzweil quote, but the timing of an invention matters as much as the invention itself, right? So I'm glad to see that, A4LI is kind of cropping up at the right time, right? 10 years ago, it was premature, right? And that's kind of evident by the fact that these other organizations didn't really get anywhere, despite the fact that none of them were set up properly. They were all 501c3s. And if this was 10 years, if something like this happened 10 years from now, it would be too late, right? The whole point of this, I think everybody can agree, is to save lives and make people live in better health for longer. So we want to get on that as soon as possible, as soon as it's viable. So, I think we got the timing down, fingers crossed. I hope so. But that's my initial thought there.
Thank you. Yeah. I also, Greg, I think just based on what you mentioned, like, I do think that in terms, like, it is now that for the first time really that we have like the right, I guess, like tools really to showcase what we have available. And I also just want to mention, just because biomarkers came up so often, Vadim Gladyshev from Harvard, he's, I think, leading the Gordon Research Conference this year together with Steve Horvath, and it's all about biomarkers. And so if people here are interested in joining this one, I will share the info on the conference here in the chat. They do have travel grants. They reached out to us and they love people in this group to join. It has a really stellar programming, as you can tell. And I'm hoping that, there may be some just perhaps a little bit more of a consensus about different biomarkers that are useful. And Vadim will also be joining at our biotech workshop the weekend before. And so he'll probably be able to fill us in a little bit more about the states and planning on the biomarker end there. So just for those of you who are interested in doing more of the biomarker related work. Okay, wonderful. Cool. So we only have 8 minutes left. Abdul Kader or AB. Do you have another point?
Yes, I just wanted to echo also the fact that, there are enough symptoms, conditions, and diseases related to age so that we can see progress immediately with regard to treatment of age. But that's not my question. My question is, what is the position of the pharma industry on the crusade against aging? Are there lobbyists actually actively supporting that agenda?
So I've had a few conversations with some of the politicos that I know, and we don't know the stance yet. At least I don't. But there is indication from some people that I've spoken to that pharma, specifically the lobbyist group Pharma, the PHRMA, they're also I think they might be a C6 actually, but I digress. But there is indication that lobbying group might be interested in helping to kind of set up this longevity caucus that we're doing. So I as far as that goes, I think there's some interest. I can't speak exactly for them, but from the conversations I've had, it seems that there could be some mutual benefit, cross interest here. And so it's something that we're definitely looking to do because they have a deep pockets and wide reaching influence. So I'll let you know when we find out a little more. Right.
Yeah.
Wonderful.
So you have actually address a pitch towards them that you have ready at hand, or is it just a meet conversation?
Sorry, wait, you skipped out on that first part.
Yeah. Do you have actually a pitch for those people?
No pitch, no like pitch deck. I mean that's not who we're lobbying. So we're not lobbying the pharma industry, we're lobbying politicians.
Okay.
Pitch deck.
I know we now have 5 more minutes left, and I want to steam both through a few more rapid fire questions because I want to make sure we tackle them. First and foremost, I didn't know you have an annual meeting in DC, and there's one scheduled already for this year. So could you just share when that is, if you have any more info on this? Because then the next question to our group would be what content and participation opportunities would encourage people in this group to attend, especially from the scientific angles, and would it make sense to think on the dates there? But like, what are the dates, Dylan?
So TBD, but it's sometime in September. What it's going to basically be is it's going to be it's going to be sort of like a fundraiser for the political chairs of the longevity caucus. That's kind of how we're going to frame it. And what we're going to do is invite all of the potential longevity caucus goers as well. We're going to invite, I've had conversations with not just, federal politicians, but also state politicians, specifically in New York. So we'll invite people like that. And, this will be your chance, the longevity community's chance to get one-on-one time with either your congressional leader or, another prominent person in Congress who has, say in healthcare policy. Right. So, that's the goal there. Like I said, this last month has been us moving to DC. So, it's been a little hectic, but, those plans will come, more into shape over the next few months.
I hope that you will update the group once you have dates on that. That would certainly, I think, be valuable for people here to know. And then like a related question is about congressional staff briefings that are usually held over breakfast or lunch. And yeah, it would be interesting, is it too early to hold these like regularly, and perhaps what should be topics covered? Or if anyone here has, ideas, suggestions for people that are really great in actually being good spokespeople for the field for such briefing sessions, that would be really wonderful. I think that would be highest value actually. So if anyone here in this group knows of folks that, can really speak eloquently for the field, especially to congressional staffers. Any ideas?
I'll just say one of the topics we'll definitely have to bring up is this the longevity dividend argument. I mean, that's really kind of the main point we're trying to push here. That even if we were, I mean, I don't know if this is. If we were to increase lifespan by not going the geroscience route and let's say, got rid of all car crashes or something like that, there still would be economic benefit, right? So, at the end of the day, we're pushing to increase life expectancy in the US. That's our goal. So, the biomarkers issue and the geroscience approach, we argue are the fastest way to see the biggest gains. But, at the end of the day, we can use the longevity dividend talk as kind of an intro point. So that's definitely one of the things we'll be doing. And we have a few people in mind for who we want to, bring to that first meeting. But, I'd definitely want to hear from the group here. If anybody has any suggestions or any other topics that you think we should cover, please, let me know.
One topic that I think might be interesting is I feel like longevity industry is like 10 years behind crypto industry. 10 years ago, you talk to someone about Bitcoin, they think you're crazy. Today, it's more or less mainstream, and they have to do a lot of those outreach and, to politicians. And so it'd be interesting to see if someone from that industry who's done that outreach to politicians could share some of their tips on how they've been successful in educating people and making them convinced in something that they didn't think about before.
For sure. Yeah. Well, the good news is the crypto community kind of likes us, right? So, maybe they'd be willing to kind of help us out with that. So, that's definitely something to note.
Yeah, absolutely.
Okay, we have one more minute left, Dylan. And so I can't let you go without asking our standard question of like, what is the number one thing that people in this group can do if they get excited about A4LI to help? And, maybe if you can target that to folks that have talent and time, folks that have scientific expertise, or folks that have funds, like what are different ways, that people can plug in?
I hate to sound like a guy who's just asking for money, but
You do. This is the type of
I mean, the fact of the matter is, and this is unfortunate, our ability, like I said, we're up against some pretty powerful players in the 501c4 space, right? So, the fact of the matter is our ability to lobby is going to be pretty directly correlated to our fundraising levels. So, we need to get everybody on, we need the base to be on board and supporting that needs to happen. And we're getting there, but this is my plea to the broader longevity community. If you want to see these issues pushed in the halls of Congress, join and support. As we, and then I'll also say, the non-monetary route. So as we build, so this is specifically for people in, specific districts in California, Massachusetts, Texas, Florida. As we build out this longevity caucus, we're going to be focusing on, those secondary, Congress people. We're going to be focusing on those districts where the longevity companies actually reside. So if you run a longevity company, work for one, even are an investor in one, anything, if you are related to one of the 100 longevity companies in, the US, and specifically the 70 companies either in Boston or San Francisco, make sure that you reach out to me so we can, properly deploy you when it's time to, right? So the idea is that we want to have constituents reach out to their politician at the same time, as we do as the lobbyist group, right? So, and that's the best way to kind of get their attention. So, please reach out to me if you're specifically in those kind of districts that we're targeting. I think most people know what kind of, what the districts I'm talking about, San Francisco, California, the Bay Area places. So if you live in those districts, Massachusetts, but if you live in any of those kind of big longevity hubs, reach out to me, because, we're reaching out to your congressperson, and you can be directly effective in helping them get on board.
Wonderful. Well, I'll trust you that when there's updates that are relevant for the group, including the dates of your conference, please share them with me. And then I'll make sure to just update them via the mailing list. Best way to stay up to date, I guess, about that, like accordingly, is like actually joining, on your guys' website. If you want to stay more up to date on those efforts, I'm hoping, Dylan, you will share all of that information with me when it's time. So, and the people on our mailing list also get to benefit from it. 2 more things. If you're interested in asynchronous discussions about these things, I'm living on Discord. And so there's our Biotech and Health Extension channel. Say hi and introductions so that people know who you are. And then finally, join our workshop this May 21st and 22nd if you want to talk more about biotech tooling and biotech prices. And biomarkers will also be a part of that session. Okay, Dylan, thank you so much. I really, really enjoyed having you here to host the policy discussions. I'm hoping that later this year you give us another update. This concludes the policy stint that we had within the Biotech and Health Extension series with you, but I'm hoping that it won't be the last time that we see you. And we're really, really excited for you to come back and give us an update. Thanks, everyone.
Thank you, Allison. Thank you so much, guys. Thank you, everybody. It's really great having an opportunity to talk to this community. And, like I said, I look forward to doing stuff in the future with you guys. So thanks, Allison.
Wonderful. Well, I'll see those of you who want to on Discord, and otherwise we'll see each other for the next seminar in this series. And those will be back to our normal technical seminars and investor Q&As. So thanks so much for joining, Dylan. Bye, everyone. Have a lovely rest of your day.